Hello, everyone, and welcome to this audio podcast. In this series, the Illmatix series. This is an RPSG and KDARs collaborative aligned with Storm Robotics production. This is the Shientist with an in this audio podcast surrounding practice in years. What I thought I'd do here is sort of provide an overview in relating and in regards to particular questions wherein sort of in anticipating a sort of a sort of a practitioner or scientific a scientific and laboratory sort of a specialist and practitioner sort of interview in sort of later in a later duration. What I thought I'd do here is provide a sort of an overview in relating to particular sort of questions, where I'll read out the questions, where I'll highlight the questions, and then I will look to provide a sort of overview. And obviously, the main interview will be aligned to will be aligned to a practice sort of a scientific based interview, again at a later duration. So so the main questions here, for example, are the main sort of questions are number one. Could you tell us about your background and how you decided to work on being part of of pathology or laboratory medicine or within the laboratory. Number two, what appealed to you about science as a career? Number three, what is the main purpose of the laboratory in which you have been involved or worked? Number four, what are your main responsibilities? What are your main responsibilities? Number five, what has surprised you most about your work, about your work? Number six, what would you describe as the main highlights and lowlights of your work in and around pathology or laboratory medicine? And number seven, have there been any major advances major advances surrounding laboratory techniques or knowledge that have changed working practices since being in laboratory practice, and since being in the laboratory sort of environment? And number eight, what are the major challenges? What are the major challenges now? Number nine, what does the future hold? So these are the main sort of questions that are part of a practitioner laboratory practitioner interview in a later duration. However, what I thought I'd do is provide a sort of overview in anticipation, if you like. So here goes. So I'm an author. I'm an author, a specialist scientist, a healthcare professional, a healthcare professional council scientist, an academic scientist, a chartered scientist, a writer, a presenter, a lecturer, a supervisor, a researcher, a blogger, a finalist for the scientist of the under a a finalist for the scientist of the year, scientist a finalist for scientist of the year under advancing um, under the Advancing Healthcare Awards in 2018 and 2022. I am the Chief Scientific Officer or CSO for the Renal Patient Support Group, the RPSG, and an acting academic lead for the Kidney Disease Renal Support Group, the Renal Support Group, or KDARs for KDARs Group for Kids. I am a fellow for the Institute of Biomedical Sciences and a chartered scientist with the Science Council. I have built experience in laboratory and health practice and comprehension surrounds pathology and general blood sciences. I have provided multidisciplinary team working perspectives from secondary to primary care. I've worked in various health settings, research and industry, and with close to or near 2 decades of healthcare research and scientific experience, I have published over 300 publications, including systematic reviews, literature reviews, mixed methodology publications, narrative reviews, and I have acquired skill mix across scientific practice. I have been involved in the development of practices, of pathology practices, and laboratory practices through several working groups, and panels. I was a member of excuse me, of NHS Blood and Transplant, a pediatric kidney advisory group, or and the subcommittee for the pediatric kidney advisory group from 2009 to 2011, and I was a member of the British Association of Pediatric Nephrology, or BAPN, in 2011 to 2014. I was also a member of the Kidney Research Education Initiative, or KREI, between 2010 and 2013. And through collaborative efforts, I have formed several publications or main publications and presented work locally, regionally, in various European countries, virtually and internationally. I have a detailed intrigue exploring healthcare in around pediatric nephrology and also immunology. And so that draws this audio to a podcast, this audio podcast to an end. This has been an RPSG and KDARs collaborative, aligned with Storm Robotics production. This audio podcast has been around practice in years, and this has been an audio podcast, part of the Illmatix series. And so with that, I want to say thank you for tuning in on this audio podcast. And again, there will be in parts of this audio podcast series. Feel free to check out the sort of resources that will be in the sort of descriptions, descriptive information in line to Storm Robotics social media, but also where there will be some information in and around the RPS on behalf of the RPSG, the Renal Patient Support Group, the RPSG in time and in duration as well. Thank you once again.